test called the OAE.
What are different common reasons that we can get these?
Okay, boss, this is malignancy, cancer.
Maybe a swelling. What is the first thing that you need to do?
But what is most important in these conditions?
Particularly ear pods, which are very close to our ears.
We also learn about something called benign lesions of the neck.
Particularly in India, and Hi everyone, welcome back. Namaste. I hope you guys are doing great. Thank you so much for joining us today. Today we are going to talk about something interesting, something we used to have in our school books. There was this one picture with a lot of neck swelling, and all we knew about it that it's goiter. That's all. But we are going to learn a lot more about it today with the expert himself. Today we have with us Dr. Sharad Nair, who is an ENT surgeon and a specialist in head and neck oncology. Hi sir, how are you?
Hi, good evening.
First of all, thank you so much for coming in, taking time out and joining us.
It's a privilege from my end as well.
I would be honored to say this, that it's amazing to be sitting here learning and talking to you. Very quickly, when I was just mentioning that there's this one picture that we have the information of about the swellings around neck, just want to understand so if a person gets swellings around the neck, what can it be and how can it be categorized into?
Okay, so when we talk about swellings of neck, it can be originating from any of the structures in this neck.
Okay.
The neck, when we say it's from this area just under your ears all the way down up to the collarbone.
Yeah.
Now there are lots of glandular structures which produce a lot of saliva in there, and lots of other glands, little glands called the lymph nodes, which are supposed to be a part of our immune system.
Yeah.
And we have certain hormonal glands, the thyroid gland sitting up here. Now if there's anything wrong in any of these areas, we tend to have these organs growing in size. Now when you have a child with a throat infection or someone walks in with a tender tooth, you can have these really small bumps under the chin, and they're all perplexed why we have it, So, but it's just a small node and you really don't need to think much about it. There are instances where you can have stones, in the glands, and they can blow up in size, and then they are salivary stone and glands. So they are treated in a different way. And there you see lots of ladies with a bump in the front of the throat, and it's the thyroid gland, and they're called the goiter, like you clearly mentioned some time back. So they're all different types. So these are the ones that you see in the common practice, but you can have little ones just when they're born with lots of huge swellings in the neck. These are to do with malformations happening while in the uterine cavity. So when they're born, they have these large outgrowths on the neck, particularly the cystic hygromas, making their life difficult after birth.
I think what I understand with something right when we are starting this conversation is a lot of misconception that we are going to clear today, a lot of new information. All we had an idea about that when we talk about that there are swellings on the neck, what are different common reasons that we can get these, particularly when we talk about children also?
Okay, now to make things easy, when we studied to make things easy, what we used to do is we used to divide it into congenital forms, which means that a child is born with it, or ones which are called acquired ones, that the ones an individual gets after they were born. Now the congenital ones are basically malformations that happen while the body is growing in utero, okay, and then you can have these spaces in the neck which remain as swellings. But as an adult or as a young child, you can have infectious reasons to why you can have bumps. Something like a simple tonsillar infection can cause lymph nodes. Okay, tuberculosis can also present as nodes and lumps in the neck. You can have goiters. Okay, these are all benign causes. Then the infections of the salivary gland, if they get inflamed, they really increase in size and they're really painful. So these are all acquired causes. Now again, when we deal with acquired causes, we also learn about something called benign lesions of the neck, which are non-cancerous. So you really don't need to do much about it. Either you leave it there, or if the patient chooses, we take it away. But the most sinister ones are the ones that we are really looking at, are the malignancies of the neck. You can have cancers of the neck, you can have lymphomas which can present as swellings in the neck. They really have to be dwelled in really well and then treated accordingly. That means surgery, radiation therapy, chemotherapy and all whatnot. So the picture is wide. Okay, it's all about how we manage to pick it up and how we manage to treat it.
You also mentioned about salivary glands that are mentioned, right here in the neck. What are problems related to that can occur?
So, to begin with, what the patient would usually have is a painful area in and around the neck or under the chin. They usually go meet the general physicians or the dentist or an ENT doctor saying that I've had this. If the person is looking into it really well, what they pick up is a roundish, painful, a bump under your chin. Yeah. So we are talking about these glands under our chin. These are called the submandibular glands. We have few more around here, around the cheek, and around and under the tongue. Okay. So any of these fellows get inflamed, they start giving you typical features of infection.
Okay.
They run fever, there will be pain, swallowing might be difficult. You can have really foul smell in the mouth. So the treatment begins with identifying it and then classifying what kind of a problem is it, and then you treat it. So the treatment would entitle anti-inflammatory medications, which will bring down the pain and the swelling, antibiotics to bring down the infection. But what is most important in these conditions is to keep our oral hygiene really healthy. Drink plenty of water, keep yourself well hydrated, and half your problem is solved.
Okay.
Yeah. So it's usually we've seen people who drink a lot, less amount of water, have really bad oral hygiene, are the ones who end up having bad salivary gland issues. Okay. Otherwise, rest of them are very easy to pick up and treat as well.
So while we are talking about how can salivary gland problems be diagnosed, going back to the problems when you're telling you might have these bumps or a little swellings, when you also we're talking about the treatments when you get cancers and you have to go through chemos and all these things to prevent. Let's go a little backwards and try to understand, one, are cancers common in the neck? Second, when we talk about all these things, how can a person understand right before they develop to a cancer stage? How can we diagnose it much before that?
I wish things were so easy, Okay, let me put this like this. I mean, we see a lot of cancer in our practice, not just the ENT head neck oncology practice. As general clinicians as well, we pick up a lot of cancers in the neck and the oral cavity. So in India, definitely oral cavity malignancies are very common, but people really don't come in with a lesion in the mouth and they're like, okay, I've got a cancer in the mouth. What really happens is they'll have a small bump somewhere on the neck.
Okay.
They are not worried about what's happening in the mouth. It must be something like a small ulcer that they've had for ages. But it is only when they have a small bump on the neck that they really reach a doctor. Yeah. And it's up to the doctor to understand if that bump on the neck is something to do with something else happening somewhere else.
Yeah.
So when we evaluate such a patient, we have to know if this is a node from any of the oral cavity regions, or if it is a nodule sitting in the thyroid gland, then it has to be proven that it is a malignancy. And how is it done? We use a small needle, pass in a needle, take a bit of it in the syringe and send it for a tissue biopsy.
Okay.
The pathologist reports back in a day or two saying that, okay, boss, this is malignancy, cancer, or non-cancerous. Now, if it is cancerous, then we are going to hunt for the real reason to why you have a bump in the neck and whether it's coming away from somewhere else. So we chase the problem, and that might entail having an imaging done, a CT, MRI, and then you pick it up, and accordingly, based upon where the primary lesion is, we treat it. So this holds true for the oral malignancies and the oral cancers. But when you have something in the thyroid gland, you can have these really small, non-painful thing in the neck that you keep feeling every now and then one fine day it grows in size suddenly and there is pain. And then when you put in a needle, it comes back as thyroid cancers. So the treatment for thyroid cancer basically depends upon what kind of cancer is it, and then taking away the gland or taking away half the gland based on certain risk factors that we know about, and then treating the patient with radioiodine scans and ablation if required. So that's what it is. It's more about finding the reason to why you have a bump in the neck and chasing down the real reason to why it is.
Now coming to that one picture we started with, and one picture that keeps coming back to my mind when we talk about the swellings in the neck. What is goiter?
Goiter, okay.
And also, any other swellings around the thyroid gland. What are those?
Yeah. So goiter means any form of swelling of the thyroid gland.
Okay.
Yeah. So technically it is because of low iodine diet, where you have, especially ladies with their endemic thyroid problem, endemic areas, goiter endemic areas, where they have these large bags of tissue in the neck. And these are not cancers basically, but it is the clinician who has to pick up and tell them, okay, we need to do a FNAC and see that we rule it out, and then we treat accordingly. Now the goiter does not usually require a surgical treatment unless it is aesthetically bad for the patient or there is a true reason to why it has to be removed. Okay. Now the problem with goiter is it's a huge growth, huge mass on the neck. And if you put a needle, we really don't know if it is going to pick up the right areas or not. So most of the times, most individuals end up getting their thyroid gland removed. Okay. Now that is the so-called goiter and the treatment that we have to do. Okay. Now we're done with the goiter bit. We have these little glands under the thyroid gland also, which can be really difficult, and they can show up as small bumps in the neck. These are called the parathyroid glands. So you can have these glands growing in size, but they are not very apparent. Okay, what really happens is the calcium in the body goes up and down. You can start having features like dengue. The patient comes in with severe bone pain, lots of stone in the kidney and all those things, and then you get your endocrine colleague calling you up and saying, I've got this patient with lots of stones and pains similar to dengue, and the parathormone is really high. And then we start looking into why a person could have that. And that's when we do a scan and we see that the gland which is supposed to produce the parathormone is really large. So when it's large, it's producing a lot of hormones and it's doing its nasty bit, and then you have pains and calcium issues. So our role as a head neck surgeon here becomes crucial, because we really have to find that fellow and pull him out of the system, because we really need to get the hormones down. Okay, and doing that helps the patient by fixing in hormone levels and everything comes back. These are not basically malignancies. It's very rare to have malignancies, not rare, but yeah, in clinical practice it is pretty rare. But we often see bumps in here which look like thyroid gland bumps, but they really aren't. They are parathyroid enlargements. So that is another facet of the whole tissue which grows in the neck. So that's about it. This is what we usually see in the clinical practice, and then we are always looking for the right treatment for them.
I think something we're discussing here is from the doctor's point of view. We are hearing is a clinician's approach towards when a patient walks in and these are the symptoms, these are the causes. Now if we talk about from the patient's perspective, as a human, as a normal man who's a part of doing different course of the day, if you feel a bump on your neck, maybe a swelling, what is the first thing that you need to do and how do you approach that?
Okay, now I'll give you an analogy to that. So while we were learning, and we still teach in our community about breast self-examination for ladies. So ladies are advised to look for any bumps and nodules in the neck when they shower, and report to a doctor likewise. So that is not something that we really advocate in the head neck oncology practice or the ENT practice, because you can't be sitting somewhere and doing this every now and then.
Yeah.
But if any of your friends or family members, they note something off on your neck,
Yeah.
something wrong in the way you speak, if there is a change in your voice,
Yeah.
or something that is causing difficulty in swallowing, the best thing for you to do is to meet a clinician, rather than sitting on it and saying, okay, this is 1 millimeter today, this is 2 millimeter after 1 month. That's not the best way to go forward, because every millimeter growth in there is going to make our life as clinicians difficult. Okay, that means diagnosing might be easy, but when you get into the whole aspect of treating it, there's a different ball game when it goes to an increased size. So yeah, definitely reporting immediately is important, and the most important thing for all of us to know and to advocate is the habits that we choose to live with.
Yeah.
You can't really be drinking and smoking and having all the bad habits and then have a small bump in your mouth or a lesion in your oral cavity, and then that grows in size, you're negligent about it, you're not even talking about it to your family member, and because it's one space you really can't see, isn't it? And then you have that in your mouth for so many years, and then that grows into a bad shape, and one fine day you have a problem in the neck, and that's when someone else in the family sees it, and then you're taken, chalo, let's go to the doc, and that becomes late. So when we see someone, we try to advocate this policy. If there is the slightest of the chance that you have a small lesion in the oral cavity, some bleeding that keeps happening in the nose, some painful area that comes and goes every now and then in the neck, something that you can feel in the neck, that you felt all of a sudden, don't sit on it. Yeah, let's go ahead and do something about it, and that's the best we can do, considering all the facilities that we have, all the wisdom that we've acquired in life. I think the best way to go ahead about it is to go meet a specialist.
Okay.
Yeah, but there is a flip side to that as well. The practice is such that if I don't know about something, and if a patient comes to me, I should be wise enough to tell the patient that, boss, I'm not the person to meet. Yeah, you might want to go to XYZ. Rather than me knowing that this is something that I can't handle, writing tons of antibiotics for a bump on the neck which has been there for 4 weeks without proper FNACs done, without proper imaging done. And that is where we fail, as clinicians. We've seen so many such practices where someone has come up to you after n number of doctors have seen and given antibiotics for XYZ reason without any benefit. So rather than me sitting here and telling, this is what you need to do, that is what you need to do when you say something, it's a joint effort. Clinicians, the people who are suffer, find the right person, go meet. If you don't like the opinion, go to another right person. Yeah. I mean, you may not like the first doctor you meet, but then there's always a chance of second opinion. And that's what we are supposed to do. I think that's the way forward. We need to learn the fact that second opinions are correct. Take the right opinion, take the second opinion, and get it done with, not sit on it.
Something I want to also understand going ahead when we are talking about thyroid glands, when we are talking about salivary glands, or we are talking about the neck, which would include, coming it from the ears to the nose to the neck. Anything that we can do in general in the lifestyle changes to keep our glands healthy, to keep this particular area healthy?
Okay, now all these regions are different. Salivary gland is a totally different group of tissue.
Okay.
So for the salivary glands, the most important thing is hydration.
Okay.
Okay, that is the thing for salivary glands. Okay, I'm not talking about malignancies here. I'm talking about simple stones, simple infections. Okay, if you drink a plenty of water, you maintain the milieu in the oral cavity. The oral cavity remains healthy.
Okay.
All these salivary glands open up into the oral cavity. If your oral cavity is well hydrated, clean, these pipelines or the openings remain healthy.
Okay.
There is no movement of bacteria into that area. There is no formation of thick saliva because you are dehydrated. Your saliva keeps moving in and out well, and there is no stone formation. So that is the thing for salivary glands. Thyroid, honestly, we don't have much to do about. But yeah, there are certain families that we've seen where they've got a genetic lineage to thyroid malignancies, where their grandmoms, aunties, mothers have had issues. If there is a history like that, thyroid malignancies, ovarian malignancies, and breast malignancies, there are genetic markers that can be picked up.
Yeah.
So you can do genetic assessments, and then you understand if you are at risk or not. So that is something that you can do about the thyroid glands, but it's not applicable in all the cases, right? About the neck, you really don't have much. It's all about your chance. And if you're unlucky, you're unlucky. If you're lucky, you don't have it. And the ones that come as nodes from malignancies in the oral cavity, the whole dictum is that you look out for any cause in the oral cavity within your nasal cavity, wherein you could have the main problem somewhere here and the nodes or bumps come on the neck.
Okay. Coming back to thyroid gland, something very commonly we hear, something I want to also clear before we say it on the camera. This thyroid gland is the same thyroid that we generally hear, कि thyroid बड़ा हुआ है, or is it the same one, or is it like?
No, there's a distinction in this. As when we talk sitting over a cup of coffee and yaar thyroid बढ़ गया, that's not usually this. We are talking about two different things here. One is the size, and one is the function.
Okay.
When in general terms, when we talk about thyroid बढ़ गया या बढ़ गया, that is usually the hormonal levels that go up and down.
Okay.
So most individuals, or the common problem with such a condition is an individual having less production of thyroid hormones.
Okay.
Wherein the thyroid hormones produced by your gland is less.
Okay.
And then you are supplementing it with something that you take as tablets.
Okay.
So those early morning pills that you take, which supplement the normally produced thyroxine in your body. So this is called hypothyroidism. Okay. Hypo because your thyroxine production is less. There is another type to it where the thyroid gland is hyperactive and it produces a lot of it.
Okay.
So there's weight loss, a lot of sweating in the hands, your hands become cold or warm, So agitated individuals, there can be signs in the eye where the eyes become more prominent, the eyelids become really wide. So these ones are called the hyperthyroidism. So these are basically all about the hormonal alterations that happen. And the ones that we've been talking about all this while is it's the GART in the thyroid gland. Yeah, that's what in the colloquial language we all use it. The GART ho gaya. They are these small nodules that form inside the thyroid gland. And these ones are supposed to be looked in with an FNAC and an imaging.
Any lifestyle changes that you can make to avoid that?
Honestly, about the malignancies, no.
Okay.
But yeah, if you can, about hypothyroidism, having a good healthy lifestyle tends to keep it at curb. But if you're genetically predisposed to it, no. So we end up picking up a patient and then treat the patient with medications. Unless there is another reason to why you could have hypothyroidism, because these are all hormonal issues that can be directed by the main gland in the brain.
Yeah.
So if anything goes wrong in here, the thyroid's go for a 6, the adrenals go for a 6, and they all start working like crazy.
Now with all that discussion about the neck swellings, different problems that can be related to it, I feel like I also have the opportunity sitting here with an ENT specialist, and I want to touch upon some other topics, or I would say misconceptions, that the questions that we generally get a lot, we have doubts about. Something when we take a part of ENT is also the neck, the ear. I'll just stop there. And so something I want to ask that a lot of us have doubts about is that nowadays we have been using a lot of headphones, earphones, loud music, and something particularly earpods which are very close to our ears. Is it healthy to use it? We have been seeing a lot of, nowadays hearing loss in children also.
Yes.
Something if you can throw a little light on.
Okay, it's quite interesting that you brought this up, and I think it is something, it's the question of the hour, because we are all living through it. And what you said is true. The more sound that we are exposed to, our ears also start responding to it in a wrong way. We really cannot be subjecting our ears to really loud sound. It's okay to have a headphone or an earpod in your ears which are of low volume and you're doing a good job with it. But you really can't have one sitting on your ears and blasting away to glory. We've all done that. We've all been through our college days. We've all done that. But we really cannot be doing it going forward. Because the longer we are exposed to such things, the more the damage is done to the inner part of the ear. These areas in the innermost part of the ears, they do not really regenerate. Once it's destroyed because of loud sound, it really does not get repaired.
Oh.
So the damage once done is
done forever.
Done forever. So now, when we were in college, we started using headphones while we were like 18, 19, 16, around that. But today, if you see, you have these little fellows sitting with a headphone on the head.
Yeah, and earpods. Not even, earlier we used to be exposed to speakers.
Yes.
Which were a little far
That's
off.
still okay. You're still far away. But today, every little one you see has a tab or a mobile in their hand.
With earpods, headphones very close to the ear.
So if you're looking at a lifespan of 60, 65, 70 years, and the child who is already 4 years, 5 years has started using this, they are increasing the duration of exposure. The duration of exposure will determine the damage to the innermost part of the ear. So gradually, by the age of 25, 30, we see really young teenagers coming in with sudden hearing loss. They wake up one fine day and they realize that they cannot hear anything. They get these buzzes in the ear, they come back, and I've been having these buzzes. You get a hearing test done, you end up knowing that they have a permanent damage, which is called the sensory neural hearing loss.
Is it repairable or?
Unfortunately, the sensory neural hearing losses, they are not repairable. The only good point that we can do or say at this point of time is if you manage to reach an ENT doctor in the first 72 hours, you have a sudden hearing loss which is nerve related. And then there are modalities wherein you inject steroids into the ears, give oral steroids, advise the patient for hyperbaric oxygen therapy, and then there are chances that the hearing can come back to near normal. But longer than 72 hours, the chances of that getting salvaged is as good as zero. So it is very important that if at all one fine day any one of us wakes up with a problem like that, you meet your ENT soon. Not think that, okay, I'll go meet him on a Saturday or a Sunday because today is Wednesday and I have to go to my office, because you might just be having another 2 or 3 days for it to really recuperate, right? So it is very important that we pick it up really soon, and even more important that we learn to stay away from loud sounds. We've got a party to attend. You're not going to go and stand near a booming sound box, sound system, because it might feel good, but how long? Somewhere down the line it's going to get affected. Looking at us, the little ones, if these guys can do it, why can't we do it? You know, that's what's happening. And all the little ones that we have around us, they're very smart ones.
Yeah.
They want to do what we do. Yeah. So what I think is, once we start addressing these things properly and be more wise about it, the little ones know about it. Another thing that I want to bring up here is about how people clean the ears.
Yeah.
Yeah.
Particularly in India, and particularly an age group we have seen putting it with the keys and anything and everything they have in their hands.
I know that's a very gratifying feeling, even I love doing it, but but it's not something that we really need to do. The point being, yeah, you feel that, you clean the ears, you think that, okay, you're cleaning the ears, but there is a little one looking at you from a corner of the house, finds the same bud someday, puts into the ear, and goes deeper than what he or she likes. It's going to tear the drum. That's going to lead into hearing loss. There's a lot of hearing loss burden in our country. Young ones born with no hearing.
Oh, okay.
Yeah, parents cannot pick it up, right? A little one's born in the family, everyone's happy, the child is taken home, you are kuchi-cooing in front of the child looks at you, the child smiles at you, you move, the child is also moving, but
take them years to just diagnose it.
Yeah, because as parents, we are happy about the child smiling back at us when we smile.
Yeah.
But what we may not be knowing is that he or she may not be hearing. He or she might just be looking at what you are doing and giving the responses back. It takes another few months or a year for the parents to really pick up that problem. And that is, after a year, they get to know that my child is not crying to the pressure cooker in the kitchen, or the grandma calls the child and child is not turning, and so that becomes a problem. And it is not something that is uncommon these days. There is a dictum wherein the hospital where the child is born should do a hearing assessment, where, though it has become quite available these days, there are institutes where the child is born and there is no hearing assessment done. A basic test called the OAE will let us know if the child has got a proper hearing at birth or not. On this podium today, what I want everyone to know is, probably, though we were talking about the neck swelling, but then this is something that is very attached to my heart, where a child born with a hearing loss loses so much in life because of that problem. Yeah. So we really, as parents, everyone, all the new parents should know that their child, before leaving the hospital, should get a basic neonatal hearing screening done. That is mandatory. Your hospital has to provide it. If it is not being done in the hospital, you need to be told that it was not done, and the parents have to get it done.
Yeah.
That is something that I really need everyone to know, because we know the burden of this problem.
That's a lot of insights. That's a lot of your wisdom being shared with us, and I'm sure that we had a lot of new insights into the knowledge that we generally don't listen to, we generally don't put so much of efforts to learn about, but something which is very important. I think all the conversation through this health podcast that we are having is something we are understanding for life, is how every part of our body is important.
Yes,
how we should be grateful of what we are given by God, that by the Creator, that we never pay attention to. We generally, we're just going through lives, and someday when you have a problem, you understand that how carefree I was while I was just going through life, and I never realized how important and precious that was that I had. As a new realization of all these things, that there's a lot of information to absorb while we are doing it. Thank you so much, Dr. Sharad, for being here, for sharing all of this with us and giving us a time.
Thank you so much. It's been a pleasure. Thank you.
With that, ladies and gentlemen, thank you so much for joining in. I'm sure that there's a lot of new information that we need to absorb, a lot of new information that we can apply that is applicable to our daily lives, and I'm sure that we're going to be more careful with whatever we do in life, because life is precious, and as precious as every organ, every part of our body is. So be more cautious, be more aware, and keep learning. With that, thank you so much for joining in the podcast. I'll see you in the next one. Until then, keep having a good day. Bye bye. Take care.